Chronic limb ischemia is very important in AMC exam. For the cause, the most common cause is atherosclerosis, while in case of acute limb ischemia, the most common cause is embolization. Well, the single most common risk factor for peripheral artery disease is smoking, and this is very important. So focus on this. For the clinical picture, the most common one is intermittent claudication. Well, that's obvious because there's narrowing of the artery, and this narrowing will cause not enough blood supply to the limb with exercise or with walking. This will lead to not enough blood supply to the limb, and that will lead to intermittent claudication or intermittent calf pain. While the serious symptoms in case of chronic limb ischemia is resting pain, which is very important. Resting pain means there is complete obstruction or maybe very severe obstruction. And this resting pain is characterized by the pain will increase by elevation of the leg and also decrease by hanging over the leg out from bed or chair. And also it will become more red in color. And this is called rubber on dependent sign, which is very important in AMC exam. Okay, so the most serious sign in case of chronic limb ischemia is resting pain. Steps of management include, first of all, check ankle brachial index, which is very important, and this is the first step, which usually done through the examination. And if this ankle brachial index is more than 0.5, so the next step will be Doppler. That's mean mild obstruction. While if the ankle brachial index less than 0.5, this mean severe narrowing or obstruction. So the next step will be CT angio. Here we cannot depend on Doppler anymore because this is a risky condition. So we need CT angio. And for the treatment, the most important advice to any patient suffering from chronic limb ischemia is stop smoking. Please stop smoking. And if the main complaint of the patient is the pain, so the treatment of choice here will be gradual exercise program. This gradual exercise program will increase the collaterals over this area, and this will lead to an increase in blood supply to the area and decreasing the pain. So the most important advice overall is stop smoking. And the most important treatment in case of pain is gradual exercise program. And finally, the drug of choice in case of chronic limb ischemia is aspirin, while in acute limb ischemia, the drug of choice was IV heparin. Now, when we use surgical intervention, we use surgical intervention in case of first, rest pain. Rest pain means complete obstruction or very, very, very severe narrowing. Okay? So, at this case, we need to interfere surgically. And also we need surgical intervention in case of complication like ulceration or gangrene. Ulceration or gangrene mean there is severe narrowing for a long period of time that's lead to this complication. So at this stage we need to interfere surgically and open the artery. And finally, we need surgical intervention in case of severe symptoms that interfere with the work or lifestyle of the patient. For example, if the patient needs walking for a long time due to his job, and this ability cannot be coped anymore due to the pain and the claudication, so at this stage we need to interfere surgically. The most important type of operation overall is endovascular angioplasty or stenting. And the most common complication after surgery is restenosis. So you open the stenosis by stenting, and the most common complication of this is restenosis again. So please focus on this. Finally, very important notes. First one is Most common risk factor for peripheral arterial disease is smoking, as we said previously. The second one is diabetic patient suffering from peripheral arterial disease. This is usually done due to microangioplasty pathology of diabetes mellitus. I mean, there is problems in the microvessels which lead to this peripheral arterial disease due to diabetes mellitus. And the final one is that if you have a patient suffering from ischemia or gangrene, maybe the tip of big toe, and when you check dorsal sphincter artery pulse, which is positive, tibial artery pulse positive, popliteal artery pulse, which is positive. So what is the cause here? The cause here is small vessels obstruction, and that's usually happened in case of diabetes mellitus. I mean, there is a problem in the small vessels, while the large vessels is patent and working well, and that will lead to ischemia, which is very important. That's all related to chronic limb ischemia. For full course, please contact us through amcqbook@gmail.com. Thanks and goodbye.